Yes, we recently did a study, an observational study, retrospective study in patients at relapse, trying to search for the sociodemographic characteristics of myeloma patients at this point, at relapse. And this was the CHARISMMA study. We included almost 200 patients, and I think it was very interesting to see how the characteristics of these patients, because this is something also we have to take into consideration when we have to select or choose the regime that we can administer to our patients at relapse. And here we saw that most of the patients, some patients most were retired, but there were 1/4 of the patients were still actively working, which it could be an impact in the treatment selection. Also, the majority of them have some comorbidities. More than 80% have comorbidities, particularly most of them were cardiovascular comorbidities. 1/3 of them had some grade of dependency from their family, so they required assistance. And what was very important for me is that the median distance from the house, from their home to the hospital, was more than 20 kilometers far. So I think this is interesting because sometimes we are very focused on what treatments they have received to select the next line of therapy, but also there are several other sociodemographic characteristics that could be influencing our treatment decisions.